Hi everyone, I'm Dr Nistha Singh, a consultant clinical psychologist with DocOnline. Today, we will be discussing about how we can influence children's behavior. So this podcast is for everyone who has children around them and not just for parents. If you are a parent or you simply have children around yourself at home, you can try these strategies to interact with them and modify their behavior. To start with, let's distinguish between the two main kinds of behaviors. First is the covert behavior, which we cannot observe through our eyes. For example, a thought process. The other is the overt behavior, which is the behavior we can see happening in front of us. This is the one we can quantify and then modify through various techniques. Parents often have difficulty in telling the difference between variations in normal behavior and true behavioral problems. In reality, the difference between normal and abnormal behavior is not always clear. Usually, it is a matter of degree or expectation. A very fine line divides normal and abnormal behavior. Normal depends upon factors like the child's level of development, situation, and time. It also depends on the child's own family values and expectations, also cultural and social background. If taken exclusively, we usually think that shouting and screaming are abnormal behaviors. But consider this situation. Your children are playing in the park with their friends. It's their summer vacation. They're enjoying a lot. So, here, should you still consider screaming and shouting abnormal? I guess not. This is how the factors that I mentioned earlier matter when we speak about normal and abnormal behaviors. You may find it helpful to consider three general kinds of overt behaviors. First, there are some behaviors which are wanted and approved. They include doing homework, being polite, and doing chores. These actions receive compliments freely and easily. Second, there are behaviors which are not sanctioned but are tolerated under certain conditions, such as during times of illness or stress. These include not doing the daily chores, baby talk, or being excessively self centered. Third, there are other kinds of behaviors which cannot and should not be tolerated or rewarded. They include actions that are harmful to the physical, emotional, or social well being of the child, the family members, and others. They may be forbidden by law, ethics, religion, or social norms. These might include very aggressive or destructive behaviors like stealing, truancy, smoking, or substance abuse. So, how do children really learn these behaviors? Behaviors which are reinforced or rewarded are more likely to be carried out again. If you are like most people, you will leave your children alone when they are behaving well. But when your children are misbehaving, you will direct your attention to them. Here, the attention is their reward, and the next time they want something, they will again misbehave and ask for it. Children avoid the kind of behaviors which are punished or not reinforced. So, in the similar situation, if you ignore the child, then they may stop misbehaving. The best way to improve behavior is to give children a lot of attention when they are doing something you like and remove your attention when they are doing something you do not like. To begin the behavior modification, we need to first understand its A, B, and C. Here, A refers to the antecedent, that is, what happens before a behavior. B refers to the actual behavior, and C refers to the consequence, that is, an action or response that follows the behavior. These include the reinforcements and punishments. Let's understand these with an example. You ask your child to clean their room. This is the antecedent. They shout and say, I will not clean it, and continue watching the television. This is the target behavior. And now you switch off the television and take away the remote. This is the consequence, basically a negative punishment. This consequence will decrease the target behavior next time. Now, let's understand the consequence part in more detail. This is the essence of behavior modification. So first comes the positive reinforcement. Here, something when introduced encourages the behavior. That is, you give your child ice cream for behaving obediently on your shopping trip. Second is the negative reinforcement. Here, something when removed encourages the behavior. That is, removing the curfew time when a teenager has proven they are responsible. Third is the positive punishment. Here, something when added discourages the behavior. For example, giving the child extra household chores for bad behavior. Last is the negative punishment. Here, when something is removed, discourages the behavior. For example, taking away the TV remote when the child refuses to clean the room. Now, what are some of the steps to set up a behavior modification plan for your child? First, it is important to consider your child's age, gender, likes, and dislikes to gauge their response to different behavior modification strategies. For example, young children may consider spending more time with a parent as a reward, whereas teenagers may consider it as a punishment because this reduces time with their friends. Next, choose the method that works best. For example, for younger children, positive reinforcement methods give the desired results. But for teenagers, combination of negative or positive punishments might be more effective. Don't hesitate to change or come up with your methods when existing ones don't work. Now, create a behavior modification plan with rewards, consequences, and punishments specifically designed on the basis of the behavior to be corrected in the child. But remember, if you push a child too much or too less, any technique may end up being ineffective. Now, coming on to some of the most important things to follow when devising a behavior modification plan. Number 1. Consistent consequences. Make sure to provide the same consequences each time when the child performs a task or misbehaves. For example, if you praise your child when he switches off the lights in the bathroom, make sure to praise him every time he does it until it becomes a part of his routine. Number 2. Immediate consequences. Make sure to provide rewards or punishments immediately after the child acts or reacts. If you give it after a day or a week, it will break the formation of a good habit and won't be effective. Number 3. Effective consequences. If a chosen consequence is not working, be ready to try another one until you find the one that works in modifying the child's behavior. And lastly, number 4. Same consequence. When all the adults, including family members, teachers, caregivers, everyone provide the same consequence, then the behavior change happens even faster. In the end, if you feel that the behavioral issues in your child are excessive in terms of either frequency or intensity, and they are interfering with your child's ability to participate in school or extracurricular activities, you are advised to consult a specialist service, which may include a pediatrician, clinical psychologist, child psychiatrists, or a child psychologist. There are a lot of professionals who are there who can help you and your child deal with these issues.